This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Hey, Southeast Texas, thank you for joining me for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. Happy New Year. We do have a question for today. I recently tested positive for COVID, and I'm trying to get back to work and then want another test. How long will I be positive? Getting back to work, getting back to enjoy your family, and just getting back into that circulation that we want to do. And certainly it's been a moving target since the pandemic has started. Most recently, the CDC did have some new guidelines in terms of returning back to work as well as quarantining, which are a lot less than the 14-day that we're all familiar with when it first started. But certainly right now, because of all the new information that the scientists and the virologists have looked at, that period is now shorter, and a lot of those recommendations do not require any sort of testing in terms of a nasal swab or a PCR or a rapid antigen test. Certainly, wherever you work or wherever you're trying to reenter, they'll have their own policy. Yes, some of them still require you to test to return and have a negative test. But unfortunately, ever since the pandemic started, depending on the test and the manufacturer, you still could have some particles of the virus in your nose that will trigger a positive test, but not be infectious. And that's what the scientists have tried to delineate throughout the whole time. When are you infectious and when you're not? And it seems to take about 5 to 10 days for that true infection time. And beyond that, the amount of infectious is significantly less. And that's why they're not asking us to test. So it can be positive for a long time, but it doesn't mean you're infectious. If you have any other questions, give us a call.